Hi, I'm Sharon Obadia. I'm a general internist and Director of Faculty Development at A.T. Still University School of Osteopathic Medicine in Arizona. In video 2, we're going to be talking about precepting medical students. What do you do with your medical student on day 1? And we're going to talk about goal setting and how important that is. So precepting for day 1, you've got your medical student, maybe it's a 3rd year, maybe it's a 4th year, and so the first meeting, what do you want to make sure gets done? Greeting the student, of course, and having the student feel comfortable in that space, discussing any clerkship objectives provided by the medical school, and set goals with regard to those objectives. The student will oftentimes bring those with them, and if they don't, you can ask them to bring them the next day. Inquire about evaluations. Ask the student what forms they are going to be asking to be completed, and making sure that you know exactly what those forms look like. You and the student can look at that form together and see what the student will be expected to do that month and to meet those the highest marks on those forms. You also want to discuss your schedule and your routines and what you expect the student to be part of during that time together. Also want to talk about proper dress. Is the student allowed to wear scrubs? Is the student supposed to be wearing professional wear, or when you're wearing scrubs? So really delineate that for the student so they know exactly how to meet your expectations. Discuss how to interact with colleagues on their team and who will orient them to their tasks. So making sure that they know exactly how they should be functioning that month, and that will be really helpful to them and their success that month. Discuss expectations for success. What does the student need to do to get those high marks that they're all wanting on that rotation? Professionalism, use of smartphones. Do you expect the student to have their smartphone available to look up things in the patient room? Do you expect them to leave their phones out of the patient room? Really set those boundaries with the student right off the bat, and don't wait for an incident to occur before addressing that. Let the student know how best to communicate with you if something were to come up. Email, text, or call, whatever you feel is appropriate, then the student should know that and be able to interact with you in that way. Electronic health record guidelines. Do you want the student to be participating on those EMRs, or would you prefer the student handwrite anything and not go into the EMR? So really delineating that with the student will be very helpful. Discussing protocol, for example, first you'll shadow me on several patients, or I'll observe you and I'll see how you're doing, and then I'll expect you to go ahead and see patients and take histories. Then we'll talk afterwards. So setting those expectations at the first day of the month is going to really help ensure success for that student. Discuss and schedule upcoming evaluation dates. So it's really important to have that first day of setting the goals and the expectations, then about halfway through the month getting together again to have a formative evaluation period where you and the student sit. It can be for 5 to 10 minutes, just sitting and discussing where that student's at this point and what they are doing well and what they can improve upon going forward for the rest of the clerkship. Discuss how to report an issue, if the student, anything comes up, what to do when things go wrong. Should the student report to you or anybody else? Providing guidelines for polite interactions with team members, and so making sure that the student knows the expectation for interacting with your medical assistants and the nurses and physical therapy, etc. So goal setting. When you set the goals with the learners prior to starting this clerkship that you're entering together, it really sets the tone for the rotation and ensures much more success than if you didn't set those goals. It clarifies what you would like the learner, the student, to get from this experience with you. And it also clarifies what the student really wants to get from this experience as well. And so maybe it's on a family medicine rotation, the student still hasn't gotten that fundoscopic exam, and maybe they would like to ask you if this month, could you help them with that? And any patients that have findings, could you please let the student know so that they can really get some more clinical expertise in this area. And also clarifying institutional expectations for the rotation. What does the school expect? What does the hospital or clinic expect from the student? If you and your student both have a list of expectations, you could take a moment and write down your list of what you expect the student to gain from this month, or you look at the objectives that were given to you by the school together, and you look at what the student would like to gain from the month as well. Compare both lists and see how you can ensure success for both outcomes. And as I said, at the midpoint and end of the rotation, take time to look at those goals and see if they've been met. This is an example of ATSU SOMA's clinical rotation evaluation, and so the student will likely have this, and it's a great idea to ask the student to bring this midpoint in the rotation so that you and he or she can fill this out together as a formative assessment, just as a throwaway to see how they're doing at that point, and then submitting the final one at the end of the month.